Enalapril, also known as Epaned, is a medication used to treat high blood pressure and heart failure. It helps to prevent strokes, heart attacks, and kidney problems by lowering high blood pressure. It also helps to prevent people with a certain heart problem from developing heart failure. Epaned belongs to a class of drugs known as ACE inhibitors, and it works by relaxing blood vessels so that blood can flow more easily. The usual dosage of Epaned for high blood pressure is 5 to 40 mg per day, and for heart failure, the usual dosage is 2.5 to 20 mg per day. It is typically taken once or twice a day, and it can be taken with or without food. It's important to take Epaned at the same time each day, so it's best to establish a routine that works for you. Always follow the dosage instructions given by your doctor, and never adjust your dosage without consulting them first. When taking Epaned, it's important to follow your doctor's instructions. You can take this medication with or without food, usually once or twice a day. Make sure to measure the correct dose using a special measuring device or spoon. Don't use a household spoon as it may not provide the accurate dose. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dosage is also based on their weight. Taking this medication regularly is important to get the most benefit from it. Try to take it at the same time every day to help you remember. Even if you start feeling better, keep taking the medication as prescribed. Many people with high blood pressure don't feel any symptoms. It may take several weeks to see the full benefit of Epaned for treating high blood pressure. For heart failure, it may take even longer, possibly weeks to months. If you notice your condition worsening, such as an increase in blood pressure readings, be sure to inform your doctor. When taking Epaned, you may experience dizziness, lightheadedness, or weakness as your body gets used to the medication. You may also develop a dry cough. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when transitioning from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should notify your doctor immediately if you experience any serious side effects such as fainting, symptoms of high potassium levels in the blood, or signs of kidney problems like a change in the amount of urine. Enalapril, the active ingredient in Epaned, may rarely cause serious kidney problems or worsen existing ones. Your doctor will monitor your kidney function while you are taking this medication. In rare cases, enalapril may also cause serious liver disease. Seek medical help right away if you experience symptoms such as nausea, vomiting, loss of appetite, dark urine, abdominal pain, or yellowing of the eyes or skin. While a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. It's crucial to avoid becoming pregnant while taking Epaned, as it can cause serious harm to an unborn baby. Make sure to talk to your doctor about using reliable forms of birth control while taking this medication. If you are planning to get pregnant, have become pregnant, or suspect you may be pregnant, it's important to contact your doctor immediately. Epaned is not recommended for use during pregnancy. Before taking Epaned, it's important to let your doctor know if you have any allergies, especially to ACE inhibitors like benazepril. Also, make sure to inform your doctor of your medical history, particularly if you've had a reaction that involved swelling of the face, have had blood filtering procedures, or have high potassium levels. This medication can make you feel dizzy, and alcohol or marijuana can make it worse. It's best to avoid driving, using machinery, or doing anything that requires alertness until you know how this medication affects you. Be cautious with alcoholic beverages, and talk to your doctor if you use marijuana. Excessive sweating, diarrhea, or vomiting can lead to dehydration and increase your risk of feeling lightheaded. If you experience prolonged diarrhea or vomiting, be sure to contact your doctor. It's important to drink enough fluids, unless directed otherwise by your doctor. Before undergoing surgery, it's important to let your doctor and dentist know about all the medications and products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication can increase your potassium levels. If you are considering using potassium supplements or salt substitutes that contain potassium, it's best to consult your doctor or pharmacist first. Older adults may be more sensitive to the side effects of this medication, such as dizziness and increased potassium levels. If you are pregnant or planning to become pregnant, it's important to talk to your doctor. You should not become pregnant while using Epaned, as it may harm an unborn baby. It's essential to discuss the risks and benefits of this medication with your doctor if you become pregnant. If you are breastfeeding, it's best to consult your doctor before continuing to breastfeed while using this medication. It's important to be aware of potential drug interactions when taking Epaned. Certain medications could change how Epaned works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Epaned include aliskiren, certain drugs that weaken the immune system or increase the risk of infection, lithium, and drugs that may increase the level of potassium in the blood. It's important to tell your pharmacist what products you are using and ask how to use them safely. Additionally, some products have ingredients that could raise your blood pressure or worsen your heart failure. It's important to inform your pharmacist about all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. It's also important to inform all your doctors if you are getting injections for bee or wasp sting allergy desensitization and are also taking Epaned. Make sure all your doctors are aware that you use this drug. If you suspect an overdose of Epaned and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Symptoms of an overdose may include severe dizziness and fainting. Remember not to share your Epaned medication with others. In order to help Epaned work better, consider making lifestyle changes such as regular exercise, quitting smoking, and following a low cholesterol/low-fat diet. It's important to consult your doctor for more details on how to make these changes. While taking Epaned, it's important to have regular lab and medical tests to monitor your kidney function and potassium levels. Make sure to keep all your medical and lab appointments, and consult your doctor for more details on these tests. Additionally, it's crucial to have your blood pressure checked regularly while taking Epaned. Your doctor can teach you how to monitor your own blood pressure at home, and it's important to share the results with them. If you forget to take a dose of Epaned, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Epaned, it's important to follow the specific instructions on the product package or ask your pharmacist. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of Epaned, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.